Good morning, supervisors. Good morning, community. Thanks for this opportunity to provide the update on our COVID-19 response. I'll start with some of the data and then get into some of the key priorities and strategies for the next couple of weeks. Next slide, please, Alvaro. I want to start by thanking Alvaro for over a year of amazing navigation of the slides. This is our COVID-19 pandemic response since the beginning in terms of our case rates. This is daily cases, and we're seeing steady declines coming off of that fourth wave that peaked in early August. Next slide, please. This shows our hospitalization rates, 12 in the hospital in Marin County now across our 3 hospitals, 3 in the ICU. That's consistent with that pattern in terms of the case rates of a steady but slow decline. Next slide, please. This shows the variants of SARS-CoV-2, which is the virus that causes COVID-19. We are still sampling as many samples as we can routinely. Those samples are now generating really the same response each time, which is that we are seeing Delta. Now, over the past 6 weeks, we've been only seeing the Delta variant. We will continue to sequence variants because as new variants emerge, the only way we'll detect them is obviously by continuing to sample. But right now we are in a really Delta dominant stage. Next slide, please. Our dashboard that tracks our vaccination rates has been updated. This is a screenshot of what the community would find on the website. It shows our total population that are eligible and then those that have been vaccinated. We are now at 98% of our eligible population, 12 and above, have received at least 1 dose. 92% have received both doses, are fully vaccinated. And now we've added in the red there on the bottom, the boosters. So one of the additional features of what we're tracking is now booster doses. We have about 16,000 residents who have received a 3rd dose or a booster. Next slide, please. One of our, and Matthew illustrated this in his previous comments regarding one of the key priorities for our response as a community has been taking an equity approach to our pandemic response, recognizing the disproportional impact of COVID-19 on communities, low-income communities and communities of color. What's important about this is our vaccination rates by race ethnicity. First is that our Latinx residents have the highest rates of any group. 98% of our Latinx residents have been vaccinated. And now the group, Black and African Americans, as well as whites, now have the same vaccination rates. 89% have received at least 1 dose in both of those groups. And that really has closed that gap. 3 months ago, our rates among our Black African American residents was more than 10% lower than our rates among our white residents, and that gap is closed. Next slide, please. This is also an additional feature to our website, and I just thought it was a beautiful image that our epidemiologists come up with and wanted to share this with you. What this shows over time is the different vaccines that people have received. So there's the Moderna and Pfizer, which are the dark blue. 1st dose, which is gray. 2nd dose is the darker blue. And then you can see the Janssen as the yellow there, and you can see when those people in our community were receiving those doses. And now on the far right, you start seeing boosters in the red starting to emerge. And we'll continue to track it this way graphically. Next slide, please. So this is the overall distribution in our county of who's received what in terms of their first series. It's about 1/3 Moderna, 2/3 Pfizer. And then a small percentage of J&J, if you want to think sort of broadly about it. So right now, because Pfizer is authorized for boosters, the majority of people who are eligible can actually receive that booster because the majority received the Pfizer vaccine. We're looking at potential authorization of Moderna coming on later this week. I'll speak about that in a minute, but that's about 1/3 of our population received the Moderna vaccine. Next slide, please. So one of the things I wanted to highlight as a priority for us moving forward is making sure that those who benefit from a booster dose are actually getting that dose. And there's more and more evidence that older residents really are uniquely vulnerable in terms of waning immunity and are higher risk for bad outcomes should they be infected even after they've been vaccinated. And concerningly, only about 25% of our residents age 65 plus who are eligible have received a booster. So we've set a goal that 50%, half of our eligible Marin residents age 65 and older will have received a booster dose before November 12th. And that date was chosen because it's 1 month from now. So within a month, we want to have at least half of our eligible residents of age 65 and older have received that booster dose. And here's why. Next slide, please. And the reason is that we know that our older residents are at increased risk for hospitalization with post-vaccination infections. Post-vaccination infection and breakthrough infection synonymous. 77% of Marin residents who are hospitalized after being fully vaccinated, so that's breakthrough hospitalizations, are people who are above age 65. That's 20 out of our 26 breakthrough hospitalizations have been among those older residents. So we have local data that substantiates what we've seen nationally in terms of that unique vulnerability based on age. Next slide, please. So there's two factors that really support a recommendation for booster dose for older residents. The first is waning immunity. We know that the immune response weakens over time, especially in people who are older. We also know that the Delta variant, all vaccine types are less effective against the Delta variant. So there's really a combined effect there. On the left, you see the summary of CDC analyses of multiple different, there's 6 different studies that compared that looked at the efficacy of the vaccine pre-Delta, so that's mostly the Alpha strain and others, versus the Delta strain, which is really our dominant strain right now, as I said. And the vaccine just is not as effective as it was. In all those studies, they found basically some evidence that less effectiveness. And this is independent of waning immunity. This is actually just the effectiveness against that particular variant. So those two factors combine in a recommendation. Next slide, please. So our recommendation is that Marin County Public Health is urging residents age 65 and older to get a COVID-19 booster and a flu shot. Importantly, we're coming into flu season. We know that in normal years, flu actually is a significant contributor to preventable hospitalizations and deaths. It is a vaccine preventable disease. And most operations, if not all, who are offering COVID-19 boosters are also offering flu shot at the same time. There's no reason you can't get them both at the same time, aside from maybe having two sore arms rather than just one. Next slide, please. So here's where you can go to get a booster shot and a flu shot. And this is also available on our website at getvaccinatedmarin.org. We have several mobile clinics, and these are the locations. There's also a clinic inside the Northgate Mall, Tuesdays and Wednesdays 1 to 7, and Thursdays from 9 to 3. That you can walk in to that setting and get vaccinated for both COVID-19 and booster. And then our local pharmacies are important partners listed at the bottom. And the majority of boosters that are happening right now are actually happening in those local pharmacies across the community. Next slide, please. So just to signal that this week is a big week federally in terms of conversations about what's going to be authorized. October 14th, they're going to be discussing authorizing Moderna for boosters 18 and older, and then October 15th, they'll be talking about Janssen boosters. We anticipate that both of those will likely be authorized and available. Our plan in Marin is to feather those products into existing operations where we're offering boosters for the Pfizer vaccine. All pharmacies will be offering those as well, but it's worth checking. If you have been vaccinated with Moderna or Janssen and are seeking a booster, reach out to your provider before you go to make sure they have that available. I know all are planning to, but it may not happen in the first week. And then on the 26th, they're considering the Pfizer vaccine in children 5 through 11 years. And we're really eager for them to offer that authorization because we have operations and plans in place to get our children vaccinated over the month of November. So by November, all products may be approved for boosters for eligible residents, and children age 5 to 11 might be eligible for Pfizer. Next slide, please. So let's get to masks. There's been some activity on the policy front with masks last week. And just thinking back, so we remember the context, in early August, Bay Area counties added local restrictions to the California state mask mandate. This was in response to the surge in cases that was happening with the fourth wave with Delta. And basically that additional restriction was that locally, all must cover their face in indoor public settings, regardless of vaccination status. So what we essentially did locally across the Bay Area is to say that even vaccinated people needed to cover their face in indoor public settings. Remember that the state still required that unvaccinated people need to cover their face in indoor public settings. And the state requires that in schools, indoors, everyone, regardless of vaccination status, needs to cover their face. So what we did last week was those same Bay Area counties that had responded to the fourth wave with that additional restriction announced the criteria that we will be using to lift that added local restriction. And I'll go over that in a second. And then additionally, Marin and San Francisco added an exemption to our local mandate. Next slide, please. So what is the criteria that we'll be using to ease that added restriction on the state mask mandate? It will be based on COVID-19 transmission rates, hospitalization levels, and progress towards vaccinations. Next slide, please. More specifically, so how we're looking at COVID-19 transmission, we are shifting from using the California blueprint to using the CDC's the metric, what's called transmission rates at the local level. It's tiered, it's a familiar process, it's color-based tiers, but they use a slightly different metric. That you look at weeks, cases over a week period rather than a day period. And we must be in the yellow level in the CDC's community transmission tracker for at least 3 weeks in order to lift that local mask mandate. Currently, we are in the orange level. We need less than 18 cases per day on average total. These are not per 100,000, but total cases in Marin per day on average for 3 weeks in order to be able to move forward. That corresponds pretty well to that 7 cases per 100,000 per day that we had been using as the margin between purple and red when we were in the blueprint. So fortunately, it does line up. Right now, we're at about 19 cases per 100,000 or 19 cases per day in Marin. So we're right on the margin of orange and yellow. Hospitalization levels need to be stable for us to be able to lift the mask mandate. We're looking at our hospitalization rates as where they were when we put this policy, put this criteria in place last week, which was about 15. So we want to have below 15 people in the hospital in Marin County in order to lift. Right now we're at 12. We expect that to continue to decline as case rates decline. And finally, vaccination progress. We need to have at least 80% of our population fully vaccinated. And we've already achieved that. We are now, as of a few days ago, now at 80% of the population fully vaccinated. So we met that criteria. Next slide, please. This is just for national context, and it shows this is the results of the CDC tracker of transmission rates by county. And what this shows is that the majority of the nation is in high transmission. There's a small minority of counties that are in substantial. And if you look on the far left there, California, you can see that California actually has the lowest transmission rates of any state in the nation right now. And Marin is in the Bay Area counties in Los Angeles have orange tier, that's substantial. And we are on the verge of becoming one of that very small number of the over 3,000 counties across the nation that would be moving into the moderate transmission tier. So for those that might be concerned that we may not be prepared yet to lift that additional local restriction, it's important to recognize that Marin County has, by virtue of having some of the highest vaccination rates and most highly protected county, also has some of the lowest case rates in the nation. So if anyone can do it, we can. Next slide, please. So here's where to look to track our progress. The website, you can look at CDC has that tracker. It's really easy to use. You just pull down the state of California, pull down Marin, and it offers some metrics. It's updated every day, and it looks back at the previous week. And then hospitalization rates are on our website that I share with you on a weekly basis here. And then our vaccination progress is also on the website. Next slide, please. So in addition, locally, we added an additional exemption to our mandatory vaccination policy. And that was for settings where we could be sure that in the context of low case rates and high vaccination rates, we wanted to make sure those settings, with the indoor settings where it was not a public setting, but it was a membership-based or a fixed cohort of individuals behind closed doors, where we can be sure that 100% of the individuals are vaccinated. No exemptions, no test out options, but everyone is vaccinated and they're indoors together. That those individuals need no longer cover their face all day together in that setting. And so that's the additional exemption. They must meet the following criteria. No more than 100 individuals are present in the same physical space, and the host, employer, or organizer must verify that all individuals present are fully vaccinated. Again, no exemptions. They need to maintain a list of individuals present, and they have to be able to control access to that setting, so it's not open to the general public. It is up to an individual host, employer, or organizer to determine whether or not they meet this criteria. If they don't, all it means is that they're, with the rest of us, waiting for the mask mandate to lift. So this is optional. It's an incentive to make sure that our settings are as safe as they can be, and that subset of settings that have taken that step to verify everyone is vaccinated are able to move forward before the rest of us in relieving the mask mandate for vaccinated people indoors. Next slide, please. I'm going to quick go through steps for safer celebrations. We're coming up on Halloween. We did see a surge in cases after Halloween last year. We also saw an uptick in cases after Thanksgiving and another uptick in cases after Christmas. So we know that holiday gatherings are, in fact, a significant risk for gatherings that lead to transmission. So let's just remind ourselves of what we can do to have a safer Halloween or Dias de los Muertos celebration. Next slide, please. The first is to get fully vaccinated. Vaccine is really the single most important thing any of us can do. We talk about the other, a layered strategy, but there's one layer that is unlike the others. And the layer of immunologic protection is really categorically different than any of the other steps we're taking. So I always want to be, as clear as we can be, that vaccination is by far the most important thing any of us can do to protect ourselves. So that's to start with. Then stay home if you may have COVID-19. These are familiar messages. If you're having symptoms of COVID-19, please do not enter settings where others may be infected. Wear a face covering is recommended for both vaccinated and unvaccinated people currently. We will not reach that criteria where we're able to lift it by Halloween. We need to be at least 3 weeks in that yellow tier. So the earliest would be early November. So we're going to ask everyone, regardless of vaccination status, to cover their faces. Costume mask is not a substitute for a well-fitted mask that covers your mouth and face. Outdoor gatherings are far safer than indoor gatherings. And when our children are trick-or-treating, we want to make sure that they're wearing a mask that actually is a proper mask and not just a costume mask, frequent sanitizing of their hands, and passing out treats. Either do that outside or at least have a table or something in between you and who you may be passing out treats to if people are trick-or-treating. Last year, we recommended against trick-or-treating. This year, most jurisdictions recognize that we're okay to re-engage in that tradition, but we want to make sure that it's done safely. Next slide, please. And this is where you can go to see the full guidance. I just reviewed the highlights on our website. Next slide, please. I just wanted to end with this reminder of this is KO Polio Day, and this is also a shout out to our library and our Marin County archives and our historians who are able to look back to the past and help us learn from the past. We've been here before. This is 1962. Massive campaign across the county to get everyone vaccinated. The vaccine in that take was a sugar cube, some drops on it. It was a 3-dose regimen. So you needed to have 3 doses over time. So it's starting to feel familiar that it's not just 1 dose. And we were able to vaccinate in Marin County, I think 123,000 people in 1 day. So it was almost 90% of our population at that time were vaccinated in a single day in multiple sites across the county. Next slide, please. And this was looking back at the organizer of that our predecessor, our public health predecessor, and this is their quote: "This was an unprecedented demonstration of what can be accomplished when the efforts of an entire community are joined in a common purpose for public health." 1962. So I guess this is just how we roll. It's been a tradition in Marin. Marin also had the highest vaccination rates against polio in 1962 among the 6 Bay Area counties that went into this KO Polio Day, which is incidentally were the exact same 6 counties that came together for the initial shelter in place last year. So there's been a tradition of public health practice across the Bay Area that I think has protected our residents really well. Next slide, please. So in summary, our case rates are slowly declining. Hospitalizations are low and stable. High vaccination rates are protecting us as individuals and as a community. Our residents are urged to obtain protection from COVID and flu through vaccination, especially our older residents. New FDA vaccine authorizations are pending. We have operations planned for being able to optimize, especially for our pediatric population, when they become eligible in the end of this month and through November. We're easing restrictions slowly, including the mask mandate that I just reviewed with you, and we're planning for safe holiday gatherings. Next slide. Thank you. That concludes my presentation.